The next group is going to be presenting on mindfulness approaches, harnessing the power of the mind-body connection for chronic pain management.
Okay, good morning, faculty, staff, our fellow second years, first years, our family and friends. My name is Nadine Johnson, and I'm joined by my colleagues, Hanna Kobal, Arubah Mansoor, and Sagda Ramadan. Of course, we would like to take a moment to acknowledge and thank our faculty advisor, Professor Richard Sabel, for his guidance, support, and brilliant mentorship. We are so proud of how much we've learned from you, as well as our growth throughout this research process. And also, thank you, Dr. Brington, for coordinating this series. So our topic today is harnessing the power of the mind-body connection for chronic pain management. So what is chronic pain? Chronic pain is recognized as pain lasting longer than 3 months that persists beyond the healing timeframe of a recovering injury. It is an occurrence that can affect people of all ages in multiple body locations with different types of intensities. It is multifaceted, affecting people biologically, psychologically, and socially. Therefore, evidence shows that a biopsychosocial approach is most effective in addressing chronic pain. Within the occupational therapy practice, mindfulness approaches integrating biopsychosocial factors can be used as a powerful tool for managing chronic pain by helping individuals develop a greater sense of control over their pain, reduce stress and anxiety, as well as improve function and well-being. We reviewed the current literature discussing mindfulness practices and found that common approaches to managing chronic pain included meditation, yoga, Tai Chi, and the Feldenkrais method, which is a mindfulness movement designed to re-educate participants about their bodies and improve their awareness through soft movements. Evidence shows that mindfulness practices have many benefits, including 1, participants who practice mindfulness meditation reported reduced pain intensity, decreased emotional distress, and improved quality of life. 2, the Feldenkrais method independently improved pain in participants who experienced cervical and shoulder pain, as well as chronic lower back pain. Next, yoga, in addition to self-management education, showed significant improvement in participants' ability to manage their pain, and they had less fear of attempting their physical activities. And lastly, Tai Chi was associated with improved musculoskeletal strength and joint stability, as well as significant reductions in pain intensity and improved physical function.
Okay. Moving on to our research question, how effective are occupational therapy-based mindfulness approaches in managing chronic pain in adults? Chronic pain is a pervasive issue that profoundly impacts individuals' quality of life, affecting their ability to rest and sleep, perform daily activities, engage in social participation, and often leading to significant financial burden. Mindfulness-based interventions have demonstrated promise in addressing chronic pain within a comprehensive biopsychosocial framework. By integrating those approaches with occupational therapy, we can offer a holistic approach to chronic pain management with a focus on enhancing functional abilities and overall well-being. To fully grasp the impact of mindfulness-based techniques on chronic pain and functional abilities, additional research is needed. Furthermore, exploring the potential benefits of integrating those methods with occupational therapy is essential for individuals dealing with chronic pain. Okay. Let's discuss our methods. The Easy Does It Chronic Pain program was conducted in collaboration with the Corpus Health Information Center. We enrolled 22 eligible participants and concluded with 10 participants. Participants were recruited through convenient sampling and voluntary enrollment. Our inclusion criteria consisted of participants' ability to utilize technology, their willingness to commit to 8 sessions, each lasting 1.5 hours, that was conducted through Zoom, and of course their experience of chronic pain. Exclusion criteria consisted of participants experiencing experiencing severe neurological disorders, cognitive impairments, and acute pain. Regarding the program structure, the study involved check-ins, education, mindfulness movements, and discussions. Study data was analyzed through SPSS and organized through Google Statistics. Oops, sorry. Research assistants handle recruitment, consent, assessment, and data collection for participants. For pre-test data collection, research assistants administered 2 pre-tests, including beef brain inventory, a valid and reliable tool for clinical assessment of pain, and the personal activity selections assessment, where participants selected 2 meaningful activities impacted by chronic pain and rated their perceived performance and satisfaction. For weekly data collection, participants received weekly session recordings, and research assistants conducted weekly check-ins, covering their pain, session benefits, and often participants how often participants practice mindfulness movements. Lastly, we conducted post-study interview responses, and post-study assessments were administered. Primary outcome measure included changes in pain, intensity, and engagement performance of self-identified meaningful activities that were impacted by their chronic pain.
Okay, so let's get into our objectives. While doing this study, our objective while doing this study was to really assess the efficacy of mindfulness approaches when in chronic pain management. As mentioned, we initially started off with 22 participants, but unfortunately for multiple reasons, ranging from personal factors to maintaining the study's validity, we concluded with a total of 10. All 10 of our participants fulfilled pre- and post-BPI and past assessments. Additionally, our research team collected feedback through weekly check-ins and post-survey subjective feedback. Taking a look at our data from the BPI assessment, we can see that it was evident that participants experienced a decrease in overall pain levels post-study and across various measures. This includes pain at its worst, pain at its least, average pain, and current pain levels. When viewing average participants' BPI questions pre- and post-survey, the results demonstrate improvement in how participants' pain interfered in their general activities and overall quality of life. Now moving on to reviewing the past assessment, participants' past assessment pre- and post-study responses were computed on a 10-point scale and averaged. The results indicated enhancement in both performance and satisfaction. Something to note, though, was when reviewing pre- and post data was the results demonstrated conflicting scores between meaningful activity number 1 and meaningful activity number 2. For meaningful activity number 1, the results suggested a significant performance improvement, but no significant change in satisfaction. In contrast, meaningful activity number 2 suggested a significant improvement in satisfaction, but then no significant change in performance following the intervention. So essentially, the statistical analysis for activity number 1 and activity number 2 resulted in opposing outcomes. So these outcomes for the past assessment will be further discussed in our discussion. In regards to collecting feedback, our research team collected weekly data on participant feedback and their experiences. This included the pain that they were experiencing and how beneficial they found the sessions on a scale of 1 to 10. We can see here how participants reported fluctuating scores of pain throughout the 8 weeks of the program, having both good and bad days due to instances of injury, sickness, and unforeseen events. Lastly, we have our post-survey subjective feedback. Participants were prompted to answer questions like what was helpful about the program and any recommendations for the program for improvement for future studies. Some feedback that participants reported included how they experienced increased movement awareness, especially in coordinating their pelvis and rib cage. Another was improvement in daily activities with an emphasis on stabilization and alignment, and how the program provided them a new perspective on body movement. Some recommendations for future studies and for future programs, creating printed handouts, publishing a weekly agenda to just clarify lesson goals and content, and considering extending the program for a longer duration of weeks and to be shorter duration of sessions.
Jumping into our discussion, let's first revisit the main objectives. Our study was primarily aimed at evaluating the effectiveness of a telehealth occupational therapy-based program which incorporates mindfulness-based interventions in managing chronic pain. The objective centered around assessing the impact of these interventions on participants' perceived performance and satisfaction in engaging in meaningful activities, alongside exploring overall experience of pain, considering both the physical and psychological aspects of chronic pain management. Now, interpreting our results. We noted that for meaningful activity number 1, there was improvement in performance. However, there was no improvement in satisfaction. This suggests that effectiveness of mindfulness approaches may vary based on the nature of the activities, especially those involving mobility and physical functions such as walking and running. Conversely, we noted the opposite for meaningful activity number 2, where participants demonstrated improved satisfaction regardless of no evident performance improvement. This suggests that the OT-based program using mindfulness interventions enhanced the participant's satisfaction by promoting a more accepting and compassionate self-view irrespective of activity performance. We also noted the importance of tailoring mindfulness interventions to individuals' pain levels, needs, and preferences through participant feedback and the variability in pain scores. Such individualized approaches have the potential to increase effectiveness and participant engagements. Overall, our research findings strongly support the core objective of occupational therapy, enabling individuals to fully engage in their daily lives. We advocate for the integration of mindfulness strategies within occupational therapy interventions, particularly for those managing chronic pain. Furthermore, we stress the importance of ongoing research to refine our interventions and explore innovative delivery methods. We propose occupational therapy-based telehealth groups, just like the Easy Does It chronic pain program, as a cost-effective means to extend therapeutic support to a larger population. Moreover, our findings underscore the vital role of occupational therapy in fostering mind-body connections, ultimately enhancing the quality of life for those enduring chronic pain. Lastly, despite a few limitations, overall, participant satisfaction highlighted the program's success in enhancing the significant role of occupational therapy's mindfulness-based interventions in promoting holistic well-being among individuals with chronic pain. Let's now delve into the limitations of our study. Firstly, we encountered challenges regarding incomplete survey responses. Factors such as holidays, sickness, and unforeseen circumstances resulted in gaps in our data, potentially impacted the overall sample size. Participant withdrawal also presented a limitation. Despite our efforts to retain participants, external factors led to some individuals withdrawing from the study, which can introduce bias and compromise the validity of our findings. Moving on to the methodology, our use of convenience sampling warrants consideration. While convenient for our data collection, it may not fully capture the diversity of individuals with chronic pain, thus limiting the generalizability of our study. Results: the duration of our program merits discussion. While our 8-week intervention provided valuable insights, it may not offer a comprehensive understanding of long-term efficacy of mindfulness interventions for chronic pain management. Understanding and acknowledging these limitations is crucial for contextualizing our findings and informing future research, demonstrating our commitment to advancing understanding in the field.
Okay. So overall, we drew 3 conclusions from our study. First, the Easy Does It chronic pain program demonstrated a significant decrease in participants' pain level. Second, participants reported improvement in their overall quality of life. And lastly, this study underscores the potential benefits of incorporating mindfulness techniques into occupational therapy practices for managing chronic pain, meaning that it offers an alternative to traditional medication-based treatments. So, now that we've completed our study, here are some thoughts for future research regarding this topic. Future research should explore the long-term effects of mindfulness-based interventions in occupational therapy on chronic pain management, since our study only evaluated the short-term effects of mindfulness on chronic pain. Future research should also investigate the effectiveness of mindfulness interventions on diverse chronic pain populations, and instead of just looking at mindfulness in an isolated context, also examine the integration of other complementary approaches with mindfulness and occupational therapy to identify synergistic effects that may further improve outcomes for individuals with chronic pain. And finally, develop and test hybrid models of service delivery that combine in-person and virtual sessions to increase accessibility and participant engagement. These are our references, and this concludes our presentation, and we thank you so much for listening. Does anybody have any questions? Does anybody have any questions?
If you don't, it's fine.
Yes, I have a question.